Hi everyone, welcome to NCLEX Orange Study Time. You have with you Magdala. And in today's video, we're going over some Google frequently asked questions about the NCLEX examination. So let's go over the first question and see exactly what it is about, and then we will continue through the entire, mostly some of the most important questions. So the first one says, what are the eligibility requirements for taking the NCLEX exam? If you did not know, in order for you to take the NCLEX, the it's either the NCLEX RN or the NCLEX PN, you need to go to an accredited nursing school. And before you go to the school, it's very important for you to know what type of nurse you want to be. Do you want to become an LPN or do you want to be a registered nurse? So this is very important. And also, it's very important that you complete the entire program. Not only you have to complete the program, you have to take the exit exam that the school provide, and then after that, you will have to submit your application to the state. Then you can be sitting for your exam. Okay, so let's go to the second question. Can you take NCLEX without going to a nursing school? No, you cannot take the NCLEX without going to a nursing school because you need to be eligible to sit for the exam. Okay, let's see the third question. What disqualify you from taking the NCLEX? There are a lot of things that can disqualify someone from taking the NCLEX. Some of them might be, for example, if you have some kind of felony, uh, that will stop you from taking the NCLEX. If you have some kind of fraudulent thing that you did that you have in your record, that will stop you from taking the exam. And also, if you're a registered, SES offender, that also can stop you from taking the exam. If you have in your record some conviction of drunk driving, that can also prevent you from taking the exam. There are so many violations and crimes that will stop you from taking that exam. So that's why it's very important that you be careful of what you're doing before you make the decision to take the exam. Let's see the next question. Can I take the NCLEX examination without a social security number? Normally, you don't need. Well, let's say you when you go to Pearson VUE to sit for your exam, they don't ask you for social security. So all these things you only need them mostly at the beginning when you're applying for your license and all that. But if you don't have a social security with you at the time of you were about to take the exam, they're not gonna even ask you for it because you don't really need it. Okay, so let's continue to the next question. Can I take the NCLEX examination online? Unfortunately, you are not going to be able to take the exam, the NCLEX examination online. We don't have that chance. I hope we could do that. But based on the way the exam is designed, it's very difficult for them to have an online, uh, a way for us to take it online. So far we don't have that. You have to go to Pearson VUE. You have to sit in a room, in a quiet room, and there are so many requirements. There are certain things you're not supposed to wear, and they have to check you first before you can sit to take the exam. So this is a no, no. Let's see the next question. It says, how long does it take to get the ATT for NCLEX examination? To get your ATT, it all depends on your state board. Because some candidate might wait for about 4 weeks, 2, 3 weeks before they can receive the ATT. Mostly at this moment, because of the situation, what's going on, you know, it's been a little fast after you pay Pearson View to receive the ATT. So mostly, let's say that all depend on your state board. Okay. And the next question is, can you work as a nurse before passing the NCLEX? Before the pandemic, it was not really possible, mostly not everywhere. But now, because of the need of the shortage, there's for nurses, some hospital will let you work even you don't have your license. You will work under the supervision of a registered nurse. You're not going to be able to do everything. You must be going to be working as a tax and helper, like you helping the nurse, you know, doing her task. And there are some states that now they will automatically put you under the name of a nurse's aide. And you can also take the LPN license. If you went for your RN examination, you didn't pass it, so you might want to take a chance as an LPN. So now this is what some of the states are doing. So take your chance in case you don't take, in case you didn't pass your NCLEX examination. I mean your NCLEX RN. So you can go for LPN. Okay, let's continue to the next question. Is it hard to pass the NCLEX? It is very hard to pass the NCLEX. Yes, it is very hard to pass the NCLEX. That's the reason you need to focus and study as much as you can before you go and sit for that test, for that exam. If you feel like you're not ready, I'm not telling you not to go, but sometimes you might go just to see exactly how it is, but it's extra money that you will pay if you don't pass. So I would suggest you to get well prepared before you take the decision to go take the exam. Okay, and next question is, can I take the NCLEX exam 5 years after nursing school? Yes, you will be able to take the nursing examination 5 years after you pass the nursing examination. Some states have different requirement what you have to do or not. However, you will still be able to take the exam. How do you know if you fail the NCLEX? When you go take the test, sometimes when you don't answer the question the right way, you also already have a feeling that you fail. You know, sometimes you have the feeling that you fail because it depends on what you get on your exam. And after the exam, you will go home, and then you will, I think it will take about 2 weeks before your state board, um, before your state board will, 2 to 4 weeks before they can send you a paper that has a report of how you did in the test. However, there's something called the quick, some 40, I think it's of 24 to 48 hours. It's something quick result or something like this that NCNBS has on Pearson View. You will be able to check to see if you pass. And there is something also the I've heard they talk about a lot is some trick is the Pearson Wood trick. They said if you try to pay and then Pearson Wood said you already paid for that exam, that's one of the things people said. I'm not gonna tell you it's 100% true, But they said if when you try to pay, if the computer said you already paid for the exam, it's a good chance that you already passed. Most of the time, they say congratulations that you passed. If you ask a question like this in one of the NCLEX groups, something that's normally what they say. And if it's accept your payment, there's a good chance you didn't pass. So you might check, you might try it. I'm not sure if it works because I never even tried it. And so those are the three ways you can know if you pass the test: the quick result, the person view trick, and also wait for your state board to tell you if you pass or not. However, even the state board doesn't send you the report. I think there's a fourth way you can know if you pass. You might have to go to the website, to your state board website, and then there's somewhere you will check to see if you, like, in case you want to apply for the exam again and all that, you might see if you fail or pass. So that's the fourth way that you will be able to check to see if you pass the exam. Let's continue to the questions. If there Okay, is there a dress code for the to take the NCLEX? No, there's no dress code. You can wear. You don't have. There's no dress code. The only thing I know, when you go to the site, when you go to before you get to the room that you have to take the test, they will check to see if you have anything in your pocket. They will ask you if you have something in your pocket. You have to take it off. You have to take it out. You have to show it. And they will check your arm, under your arm and stuff, and your hand to see if there's nothing written. If you have nothing on your, any little notes and all that. And they will make you put your phone in a locker. They will seal it and put it in the locker, and your phone also will stay in the locker. The only thing you will have in your hand is the pencil and the board, that they're gonna give you a board so you can write. In case you need to do write something, you'll be able to do so. And beside that, there's no specific dress code for taking the exam. Okay, next question. Can you show? No, let's take something else more important. How long should I study for the NCLEX? Before you take the NCLEX, not only you need to be well prepared, and it's very important, at least 1 to 2 months you've been studying before the NCLEX. You've been studying for 1 to 2 months before you take it. Okay, don't think it's an easy exam, because it's not easy. You can study as much as you can, but if you took a break within your study, make sure you at least have 1 to 2 months close to the exam date. Okay, so that's very important, because you don't want to forget anything. And let's see what is the next question. Okay, which state has unlimited NCLEX exam? So I'm going to open this one here. It says California has has it every 40 days, as many times as you want. That means in California, after you take your exam, you can wait for 45 days, and then you can retake it. You can keep doing that over and over. If you keep going and if you're still failing, you can wait 45 days and retake the exam. However, a state like Florida is totally different. Florida, if you take the NCLEX once, twice, third time. So the third time, if you fail, you will have to go back to school. When I say go back to school, it's not like you're going to take the whole program again. I think you're going to school for remediation. You remember when we were at school, we had that term, remediation. Is some kind of review that will prepare you so you can get ready to retake the exam to make you eligible. That's why most candidates who are living in Florida, they go to another state to take their exam, because that's if you are a new grad, it's very important that you know all this information, because if you live in Florida, you're going to take your exam, you need to know how many attempts you are eligible to, because in case you don't pass, you need to have a plan B. So that's the reason you need to do your research. Okay, so like you see, California give you more more chances to retake the exam every 45 days, and I believe North Carolina is one of them. So I already give you a little tip. So next question, let's see. um how do I get an authorization to test? To get an authorization to test, first you need to pay your state board. After you pay the state board, you can go to Pearsonville and pay the money. Okay, you will pay the fee to take the exam. That means it's two fees: the application fee with your state, and then the exam fee with the Pearsonville. Or when I say Pearsonville, I mean NCSBN. That's the same thing. Okay, Pearsonville is the site. Is is it's a combination. How can I say that? Pearsonville provide test you, NCSBN provide the test and all this stuff. So you need to pay Pearsonville first. You go to NCSBN website, and then there's a link to Pearsonville, and then you pay that fee in order for you to take the exam. Okay, so this is how it works. How long does it take to get your nursing license after passing? Okay, each state each state there's things different, because as long as when you pass the NCLEX, you will look to see if you fail or if you pass. If you pass, you will have to wait at least 2 to 3 weeks. Some state you might be able to print the diploma, to print the result and all that. You might be able to print the license online, but some states you have to wait till they mail it to you. So this is how it works. Okay, let's see. You see which state is easiest to apply for the NCLEX. Each state has a different way of applying for the NCLEX examination. Some of them you have to send an application. Since there are a bunch of things that changed since the pandemic, so possibly maybe everybody might do things electronically, but before you had to fill an application, you had to print the application, you had to fill a paper application, and then you had to send it to the state. But some other state you just had to do everything online. So it depends on your state. Okay, so there's not a specific answer for to that one. Let's see what Google say about it. Okay, it says, okay, about which state is easier. There's a list of states right here. It says the easiest state to become a nurse, length of licensing process. It says Maine is 1 to 2 weeks. Wow, did not know that. Maryland, it's 2 to 3 days. Wow. Missouri is 2 weeks. Nevada is 1 to 2 weeks. North Carolina is 1 to 2 weeks. North Dakota 1 to 2 weeks. Texas 2 weeks. And Vermont is 3 to 5 days. So at least Google has a list for us. So these are the states. That's the easiest state to apply for the NCLEX. I will maybe in a different video, I might go to the application process, or I might go to the website and to see the eligibility for each one of them. But today we're just going over some of the frequently asked questions. Let's see. I might have to do a different, maybe two different videos to. Okay, this one say how many questions are on the NCLEX examination, the minimum, there's a big change right now because of the situation. I don't want to say the name that much. Because of that, the number of questions had changed. So I remember at the beginning of the pandemic, you had to answer less. I think it was like 60 questions or something like this. You didn't have to answer that many because they were in need for a lot of nurses. And then after that, like in 2021, right now, they still made another change. You don't have to answer like 75. I think you had to answer 20. You had to answer about 60 or something like this. So everything, okay, based on the pandemic, everything had changed. So it's very important, if you need a quick or you need a clear answer about that, it's good to check the NCSBN, because each time they come with a change, they are the one who made the change. Okay, but what we knew before, the number of questions they used to ask, they used to have in the exam was 265 questions, and then the computer most of the time might stop at 75. Sometimes it might stop at 75. It doesn't mean you fail or you pass. It doesn't mean that you, some people think when you stop at 75 that means you pass. Some others think if you stop at 75 that means you fail. We don't really know until you get the result. Okay, so, and some people don't even get just 75. Some get 100, 100 and up. No, it depends on the computer, because if the computer is saying that you're passing, it's still gonna give you a chance. Because the thing is, if you answer a question wrong, the computer will give you one that is even more difficult. So, and then depend on how you answer the questions, and if the computer sees that you are still in the passing, if you are still near passing, they might give you a chance to, they might keep posting questions. But if you are doing very bad, it might just stop at 75. So it depends on the computer and how you're doing. Okay, and the last question I'm going to go over is, let's see, it says, can you be a nurse without college? You can be a nurse without college. It depends on what kind of nurse you want to be. Okay, if you want to become an LPN, there's a requirement. There's certain eligibility, certain classes that you have to take. If you want to become a registered nurse, you need your prereq. You need to have at least 2 years of prereq and all this stuff before you can get qualified. And depend on what school you go, you might have to take some classes in college and some classes in the program. It depends if you go to a private school, a private nursing program, or if you go to a state board, like a national. There's a national, and then I think there's a national, and I don't remember. So there are two of them. So it depends, because some program might give you all the classes while you're in the program, and if you have a AS, all that depend on how did you start. And the thing that says, if you can become a nurse without a college degree, if you want to become CNA is also a nurse. The nurse's ed is also a nurse. So that means those are not required for you to have a college degree. Maybe you might need a high school diploma and all that. So let's see what Google say about it. Can you become a nurse without a BSN? I don't think you need a BSN to become a nurse. Okay? In nurse, BSN is mostly after you get your registered license. So BSN is way, way higher than all that. the only requirement for nurse for RN to officially practice medicine or to practice medicine without their field is that they must pass the NCLEX examination. And an RN can either have their ADN or BSN. Without the BSN degree, well, although the BSN is what most of the employers asking for. So that means the ADN is mostly when you are a registered nurse, but you don't have a bachelor degree. To have a bachelor degree, you have to go to school to get a bachelor degree. Okay, guys, this was the video about the frequently asked question about the NCLEX eligibility, the eligibility that you need to take the NCLEX RN or the NCLEX PN. So I hope you guys have some question for me. If you do, you can leave it in the video description, and also don't forget to subscribe to the channel. What I'm trying to do, not only we're going over some NCLEX questions and review, I will try also to come with some information. I will mostly try to turn the channel into some kind of resource place where you can find certain answer when you need. Okay, thank you very much for watching, and I'll see you next time.